Welcome to your sixth set of notes in Unit 8 over clinical psychology. Today we will be talking about schizophrenia. If depression is the common cold of psychological disorders, schizophrenia is the cancer. So it's not as common as depression, so not as common as a cold. Cancer is not as common as a cold, but it's much more intense and much more severe. Nearly 1 in 100 suffer from schizophrenia, and throughout the world, 24 million people suffer from this disease. Strikes young people as they mature into adults. Symptoms usually begin to appear between the ages of 18 and 20, and affects men and women equally, but men suffer from it more severely than women. Here's a map that shows the prevalence, so the rates of schizophrenia by country per 100,000 inhabitants. Notice it's in every country. The literal translation of schizophrenia is split mind. So it's a split from reality, not personality as we see in dissociative identity disorder, but reality that shows itself in the following ways. Disorganized and delusional thinking, that's delusions, disturbed perceptions, hallucinations, and inappropriate emotions and actions. So let's talk about each one of these. So disorganized thinking. This morning when I was at Hillside Hospital, I was making a movie. I was surrounded by movie stars. I'm Mary Poppins. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday. So this monologue illustrates fragmented, bizarre thinking that with distorted, false beliefs called delusion. So when this individual claims that I'm Mary Poppins, that's a delusion. These delusions can show up either as grandeur, I'm somebody super famous, or in persecution. Many psychologists believe disorganized thoughts occur because of selective attention failure. Review what selective attention means, resulting in fragmented, bizarre thoughts that spill out in no particular order. The second way we see schizophrenia is through disorganized perceptions. This is a schizophrenic person may perceive things that are not there. They're hallucinations. They are seeing things that are that's the break in reality. They're seeing things. They might see spiders crawling up the wall. There's no spiders crawling up the wall, but that's what they see. That goes into that hallucination. And then inappropriate emotions and actions. Emotions, actions are inappropriate to the situation. So a schizophrenic person may laugh at the news of someone dying and show no emotion or show no emotion at all, and often referred to as flat affect or apathy. So flat affect, so affect is emotion. So they're emotions, and then of course flat is none. Before we move on, I need to remind you that oftentimes in psychology, when we talk positive and negative, it's not good and bad. Okay, so when we talk positive symptoms, just like in reinforcement, if we're talking positive, we're adding something to the behavior. We're adding a behavior or situation. So positive symptoms, distortions or excess of normal functions, and tend to be most frequent in the first stages or early stages of schizophrenia, adding to normal functions. So this is why it's positive. We're adding to the normal functions. This is the presence of inappropriate behavior. Can include delusions, hallucinations, distorted speech, often resulting in a word salad, and disorganized behavior. All right, so let's talk about each one of these positive symptoms real quickly individually. So when we talk about delusions, this is distorted false beliefs. They believe something that is incorrect about themselves. So delusions are usually of persecutions, someone's out to get me, or grandeur. I am Superman, right? In the quote we read, that was the I'm Mary Poppins. So they have that delusion. Hallucinations equal perceptions without the corresponding sensation. So frequently as hallucinations are auditory and less often visual, olfactory, or gustatory. So they are hearing things that are not there. So they might be hearing voices in their head telling them to do things or not to do things. Oftentimes they're telling them to do things that are socially unacceptable. And remember, your sensory organs are not picking up any sensation, but your brain perceives that it is. Disorganized speech or word salad. This is disordered thoughts lead often to jumbled words that make no sense to the listener. So take a paragraph, right? Type up a paragraph, cut it, and then print it out, cut it up, re-put it into a new order, like, shuffle all the words around, and then try to read it. That's a word salad. It does not make sense. And then disorganized behavior. Patients with schizophrenia often have motor behaviors that are inappropriate. The individual may perform senseless, compulsive acts like continually rubbing an arm or rocking in a chair. So key here is the repetition. Negative symptoms. So remember, in psychology, negative means we're taking something away. This means the behavioral deficits or the loss or decrease of normal functions. So you're going to be missing some normal functions or you're taking away. So this is the absence of appropriate behavior. This includes flat affect, so avoiding eye contact, expressionless face, apathy and non-interest, monotone voice, poverty of speech, so long lapses as they speak, slowed speech, and lack of directness, so slow movement. Little interest in social participation is also occurring as a negative symptom. So chronic and acute schizophrenia. So there are two types of schizophrenia that have now been diagnosed. When schizophrenia is slow, underline, highlight, circle that, to develop. Recovery is doubtful, and such schizophrenics usually display negative symptoms. So chronic is slow to develop and negative symptoms, whereas acute schizophrenia, this is when it rapidly develops, highlight, circle, star that, so it's reactive. Recovery is better. Such schizophrenics usually show positive symptoms. Make that connection between rapid development and positive symptoms. Common characteristics. In addition to the common positive and negative symptoms described previously, we also see paranoia, preoccupation with delusions and hallucinations, often with themes of persecution or grandiosity. So I am Mary Poppins or I'm Tiger Woods. Catatonic immobility, or excessive purposeless movement. So it could be either one. Extreme negativism and or parrot-like repeating of another's speech or movement. So they will imitate somebody else. Childhood schizophrenia, one of several types of schizophrenia, a chronic mental illness in which a person loses touch with reality. So they have the psychosis. Remember, psychosis, you're breaking with reality, it's not personality break. Childhood schizophrenia is essentially the same as schizophrenia in adults, but it occurs early in life and has a profound impact on the child's behavior. The childhood schizophrenia includes hallucinations, delusions, irrational behavior and thinking, and problems carrying out routine daily tasks such as bathing. So childhood schizophrenia will affect their ability to learn new tasks because it interferes with their ability to learn those tasks, which in adults, they've already learned those, so they can keep doing them even if they have a break with reality. So these children are having a break with reality and not having the ability to learn new skills and tasks. Understanding schizophrenia. So schizophrenia is a disease of the brain exhibited in the symptoms of the mind. Brain abnormalities, dopamine overreactivity. The researchers have found that schizophrenic patients express higher levels of dopamine D4 receptors in the brain, which means dopamine is just rushing in. There's more ways for the dopamine to trigger the neuron to fire on that dopamine. So in an abnormal brain activity, so brain scans show abnormal activity in the frontal cortex, the thalamus, and the amygdala of schizophrenic patients. Go back and review, what does the frontal cortex control? Like, what is it responsible for? What's the thalamus responsible for? What's the amygdala responsible for? Go back and then write them down in your notes so you have them there. It's a great way to review Unit 2 biological basis. And also, adolescent schizophrenic patients show brain lesions. Abnormal brain morphology. So schizophrenic patients may also express morphological changes in the brain, like enlargement of fluid-filled ventricles, which you see on these scans right here. On the left is a non-schizophrenic patient. The kind of the butterfly image in the middle is much, is what they would deem as normal size. Within the schizophrenic, it is much larger in area, which means that areas around that spot are going to be squeezed and or maybe smaller in size. Brain anatomy and schizophrenia. So there's abnormally low activity in the frontal lobes. They have hallucinations, too much activity in the thalamus. They don't know what to shrink, what to ignore. The greater the shrinkage of the hippocampus and the amygdala, review what those are involved in and what they are like kind of control, the worse the disorder. And if the thalamus is small, the greater difficulty in filtering information and possibly reacting in the correct manner. This also helps explain disordered thoughts and like that word salad, because they are unable to filter the information accurately. Why do these brain abnormalities occur? Possibly due to prenatal problems. So low birth weight, you have birth complications, and infections that the mother has during pregnancy, especially influenza during the middle of fetal development. And this is why it's so important that they always recommend pregnant women get the flu shot if they're going to be pregnant during flu season. Genetic factors also play a role. The likelihood of individuals suffering from schizophrenia is 50% if their identical twins have the disease. Now, if they're identical twins, it does not mean they're going to suffer from schizophrenia. It just means this is just proving the genetic factor is at play here. Go back and review heritability. Early warning signs of schizophrenia include a mother's long-lasting schizophrenia, so genetic clearly got passed on, birth complications, oxygen deprivation and low birth weight, short attention span and poor muscle coordination, disruptive and withdrawn behavior, emotionally unpredictable, and poor peer relations and solo play. That wraps up your 6th set of notes in Unit 8 of Clinical Psychology. If you have any questions, come see me. And remember, don't do anything too stupid. Bye, guys.